are the initiatives or, are there organizations that are working specifically towards this area to, first of all, to make reporting a easy process?
Yes.
And, then comes, once it's reported, how fast the person is able to get justice. I think that's a long process in itself. So,
Mm,
what
mm.
is happening, in Wales in this regards?
So in Wales, we have a very good network of what we would call our specialist organisations. So they um, work. So we have a network of women's aid organisations. So we have Welsh Women's Aid, which is an umbrella organisation, and they have member organisations delivering the service across Wales. Welsh Government also fund a Live Fear Free helpline. So that's for anybody affected by violence against women, domestic abuse and sexual violence. So there's an entry point for people. It also provides guidance to professionals who don't know what to do if somebody discloses. So in our specialist services, we still have high demand. So we don't have enough refuge. So I don't know if the term refuge it would be familiar to people. So that's our safe houses in essence. So when a woman has experienced domestic abuse, those are our places of safety. They are funded by government, but there aren't enough of them. And we know at the moment we have a bit of a housing challenge. So we struggle to move people on from those refuges. So we've got a bit of I suppose, I don't know, a, a blockage in that people newly needing to come out of and come into refuge are having struggles with that. But we also have outreach services, we have counselling services. We probably have more counselling services for those affected by sexual violence than for domestic abuse, but there is something. We have services for children. In England and Wales, we recognise children as victims of domestic abuse if they've been in a household where it's occurred. That's in the law. So we have children's services, but not enough. And for children, we really need more therapeutic support. We know what happens when children don't have the interventions early on enough. They develop mental health issues, they develop all of those associated issues. So we really need to do more about them. We have an initiative in all of our police forces called Operation Encompass. So schools, whether it's primary or secondary schools, they will be notified if there has been an incident of domestic abuse within the home within 24 hours. So that child should then have a nicer reception in school, like if recognizing they might need some space or they might want to chat or they might need to have some food, rather than that child feeling like nobody knows what's going on and, feeling embarrassed that they're still in the same clothes or feeling hungry or whatever because things have been too busy. There should be that safe reception in school the next day. Like I said, we also have Ask and Act. So our public services should be allowing and enabling people to disclose. So if somebody has, mental health issues and it's suspected that that's as a result of trauma, they should be asked about that. If somebody's in our accident and emergency services and they have a broken arm and somebody suspects that there's more to it than that, they should be asking about those questions. That should have a response from our public service colleagues, but it should also lead to a referral. We have some special initiatives. So we have something called IRIS, which is our general practitioners, our GPs, are trained to be able to safely ask questions about domestic abuse and sexual violence. And then we also have specialist services in those surgeries ready to support people. That service is seen to be particularly good for older people who often don't disclose. We often under-identify for older people. It's a significant issue for us. We assume it's a safeguarding issue. We don't enable people to access criminal justice. But if I can give an example of a success for Iris, we had somebody who went to their GP every week for 20 years with minor issues, never fully getting to understand what it was. That surgery was trained in IRIS and she disclosed domestic abuse and then she was supported into safety. So we know that initiative works. So things like that are really important for us. At the moment, we're looking at, so we have independent domestic abuse advocates and we also have independent sexual violence advocates. They support people through criminal justice processes, which is really important because we know how hard it is. And they should do the ongoing safety support at the same time. In Wales, we're really great at partnership working. So we do have excellent relationships from our, our health practitioners and etc. with our specialist services to work together, because that's really important. We know that victims and survivors mostly trust the specialists and they want to get
Yes.
to them, but we know that the entry point is often our public services. So that working relationship is really important.
So, Jen, you talked about the safe refugee houses where people,
Yeah,
women who have suffered abuses or their children who have witnessed
yeah.
it. So, is there a period for which they can avail it, or is it till the person comes out of it and has taken a legal recourse and, uh, you know, um, what I want to say is she is fit in every way, has
Yeah.
come out of it.
Yeah, so they're probably at the moment, probably women are in there too long because they might be so it's whether she goes back to her home, that she left, or whether she goes to a new home somewhere. So our refuges may or may not be in the community that the woman comes from. More often than not, they're somewhere else because of safety concerns.
So
So
it's
they would be for victims and survivors where there is there's a threat, there's a concern, and um, yeah, so it should be for as long as she needs it until she is ready to move on. There may be some social services intervention around children and protection and so on. And she may go back to the relationship. We know that happens very often, but she shouldn't be forced out just because it's been 6 weeks or 10 weeks or three
okay.
months. That shouldn't happen. It should be at a time that works for her.